Welcome to the Think Factory podcast. We got one question for you. What keeps you up at night?
Hello and welcome to the Think Factory. Today on the Think Factory, we're diving into one of the toughest leadership environments in America, running a hospital that serves everyone, regardless of their ability to pay, and still finding ways to innovate and thrive. My name is Susan Kleiner. I'm from OGC Solutions, and our guest today is Ken Coe, the Chief Financial Officer at Humboldt Park Health in Chicago, a health system that is dedicated to providing compassionate, high-quality care for all members of the community. And along with its mission of advancing health equity, Humboldt Health is thriving, leading the charge in wellness, transforming neighborhoods and communities and the individuals they serve. Ken, welcome to the show.
Thank you, Susan. Really happy to be here. Appreciate the invite.
Yeah, well, it just sounds like, your organization is doing amazing things in Chicago. And I think that people could really take notice because you live your mission and you are thriving. Can you share a little bit with our audience, what is Humboldt Park Health?
Yeah, so formerly known as Norwegian Hospital, 5 or 6 years ago, decided to make the change to Humboldt Park Health, which was more kind of reflective of the demographic here now. We are a 200-bed hospital, have pretty much every service line that some of the larger hospitals have, from family medicine to surgery to coming up soon, bariatrics. We're here centralized in Humboldt Park, right on the Humboldt Park border with Westtown. We serve roughly 27,000 emergency visits each year. We are a staple and kind of a flagship here in the community. We provide just about 900 jobs, most of which, 60% of which are full-timers, the other 40% part-time. But nonetheless, we're here. We are everything that Humboldt Park embodies.
And you're more than just a hospital, right? It's more than the ER. You're looking at much bigger picture health. Can you tell me a little bit about how you're doing that and how you're growing your mission?
Absolutely. So, obviously the mission is care, but more so wellness and preventative care. And so what we've done, one of the most recent things is we just finished about a year and a half ago our $30 million wellness center. The state and the city were happy to provide subsidies so we could make it happen. But that opened in January of 2025. We anticipated that we'd break even roughly 18 to 20 months. We broke even in 7. Not only do we have 2,700 plus members, we also have elected officials that work out there as well. Our local alderwoman, but also State Senator Omar Aquino, who is not only a stalwart here in the community, but a proud member of Humboldt Park Health and our wellness center. So the idea is not just a hospital or in an ER room. It really is an emphasis on wellness. And so right now we're working on a behavioral health outpatient clinic. We're working on 100 units of affordable housing just a block away from the hospital. And many more projects that are up and coming. We'll have an urgent care within the next year or so as well. So it really is about preventative care. I mean, we really, we're happy that we can serve 27,000 people in the ER, but the emphasis again on wellness is let's keep everyone out of the ER. Let's make sure that we're not getting people on their last legs, because they're without health insurance or without the resources. Let's give them the resources to stay out of the ER and have a more sustainable and well-rounded life.
That's amazing. Now, I know that this is the first not-for-profit that you've worked for, but you're not new to the health industry, I don't think. I'm just curious, how has it been for you making this change? What's it been like? And tell me some more about that.
Yeah, so I actually was privileged to be the vice president of the board of Chicago Gateway Green. which is one of Chicago's largest and oldest not-for-profits. So I did gain quite a bit of experience there. But as far as professionally, I think the transition from corporate to not-for-profit, it's only successful if you're a mission-driven person. If you're okay with just collecting a check and, being really good at your position in the corporate world, then great. So, and that's a lot of people. But, my mother was an educator for 35 years, and I always used to tell her, I said, look, I'm kind of jealous because, you're able to impact at the very least 25 lives a year. So at the end of your career, you can say, you've impacted, 1,000 people. At the time I was in corporate, I wasn't impacting anything. And so again, being that, I'm a mission driven person, I think for me, it was an easy transition here in the hospital because not only are we a safety net, because we're a safety net, my actions and my input have a really big, I can affect change, let's say, every day that I'm here. And that's been really rewarding and validating. And that's the type of validation and reward that I wasn't feeling in the corporate world.
I hear you. And I know the last time we spoke, so you're the CFO, right? So, but you told me, I think, that you don't lose sight of who you serve and the mission. I think you told me that you even go on rounds, like you round once a week to keep it real. How did that come about? That's got to be unusual to have the CFO go on rounds. What's that?
Oh, I've been privileged to work with probably one of the greatest humans and one of the best CEOs to me in the nation, Jose Sanchez. And being that we're a small safety net, we've had some attrition, and through that attrition, I said, look, I'll pick up some of the slack on the operations side. And he said, look, don't let the finances fall through the cracks, but yes, I'll give you an opportunity. And with that opportunity, I consider myself a lifelong learner. And I took that opportunity to really start trying to learn as much that I could. Not necessarily on the patient care part, because I am not a clinician, but from the hospital operations standpoint, I go on a rounding. Actually, I was doing it today. So every Thursday from 9 to 10, I'm rounding on two specific areas. So today it was the cath lab and telemetry, but I'm looking for everything. I'm looking for, any type of violations, any type of in any areas that may not be in compliance. That could be something as small as signage. It could be, something as small as like water damage on one of the roof tiles. Or, I go in, introduce myself to patients, because it is really about patient care and patient outcomes. So one thing I think we do a really good job of here is just making ourselves visible, not just to staff, but in the C-suite position. Sometimes you can be siloed. We do a really good job, and I take it personally when I don't know, a long-standing patient or, even a new employee. So yeah, I spent this morning, talking to patients, rounding, making sure that if there was one of our governing bodies were to give a surprise visit, that we were in compliance, and just making sure that we're a hospital that does things the right way.
One of the things that you hear about in healthcare systems and healthcare generally is, how tough it is to be in healthcare, how there's a lot of attrition, nurses leaving, et cetera. I have to imagine that the kind of care and compassion that you're showing to your patients and also to your staff is helping your system continue to thrive.
I think it's being intentional, right? It's not just, hey, at 9 to 10, you must round. It's really being intentional with your rounding. It's really being intentional about, the community you serve. I think that's key. Most of our patients here obviously come from within a 1.5 mile radius of the hospital. And so these are people that we see on the street. These are people that come to our community events. And we don't want that outcome to be adverse. We want people to hug us and say, hey, when I came there for this procedure, I feel great now. Thank you for the care that we provided. And that's from the top down. Our CEO does a spectacular job at making sure that we understand what's most important here. And again, it's patient care and quality.
So how do you balance financial sustainability along with this mission that you have of serving the community? And obviously, I mean, you serve everyone, and a lot of your population is vulnerable. It's a lot of underserved, predominantly previously underserved folks. How do you balance it all and survive and thrive?
But I think it's multifaceted. I think on the back end, behind the scenes, what people don't see is, our CEO is a champion for not just Humboldt Park, but for all of the safety nets. So he's probably our greatest lobbyist. He's in Springfield. He's in Washington. He's meeting with the American Hospital Association, the HFS, the IDPH, just campaigning for supplementary, payments and income. And so that's been extremely helpful. He's raised over $500 million in his 15 years here as CEO. I don't know many safety nets that can say that. So that's one area. But the second area, it's being really mindful of every dollar that comes in and goes out. So my profit margins are less than 1%. And so, every $100 we make, we can only spend, 99. And that's a task all in itself. And that requires discipline, but it also requires extreme checks and balances. And you have to have the personnel to pull that off. Fortunately, we've been lucky. We've had some really, really good and mindful employees that control our materials management. Our purchasing has to be pretty tight. The nurses even, the nurses have been tasked with understanding their budget in their department and so on. So, again, it's being intentional about really understanding where the dollars are and where to invest. And me and my CEO, we've really we've done a really good job at preserving some of the supplementary dollars that we've had, but also the income that we bring in and the revenue we generate.
That's really great. I know one of the things that you've spoken about in the past is, or of course, I think everybody's talking about it now, right? Which is AI. And how is it that, Humboldt Park Health is putting AI to work? And what kind of lessons, could you impart on other smaller hospitals or health and wellness systems?
Yeah, so one thing that I don't like about AI, kind of has a negative connotation at times, is, it's going to replace people. So that's one thing I don't do. We've been able to implement AI all throughout the hospital for automation in finance, ambient listening when doctors are speaking to their patients. We actually have a really cool feature now. Patient falls is a metric. It's a really big and important metric throughout the hospital healthcare system. We have a piece of hardware that is a predictive fall technology, so that when a patient is by themselves in their bed, it will alert the nursing staff when, it'll try to predict if that patient will fall. And that's been really essential for us because it helps our nurses, focus on other tasks and kind of have that security and understanding, okay, what's the risk here? And so AI has been a friend of ours, but it's important to be intentional there as well. So, we're really picky on, who we kind of partner with. A lot of the vendors, every day I get 20 emails about AI and what these technologies can do for us, but we're intentional. We know where the needs are, and we're not wasting any resources on things that are on a wish list. We go for the needs and not the wants.
It also sounds like, be intentional, be smart, but don't be fearful, right? Like go ahead and invest in the technology and, take the risks or take the chance and do your homework. This fall risk thing sounds, really amazing, and that it could be, changing, I guess, the way people operate. So I'm also curious, big picture, right? Big picture for Humboldt Park Health. and what lessons that you could help give to other hospitals. What does thinking differently look like in healthcare today? And what advice would you give to other hospital systems, other health systems, looking to achieve equity? I mean, that's a pretty big mission, right? Is equity in healthcare?
Yeah, absolutely. So I think the first question, or first answer would be we run our business like a Fortune 500 company. That we don't run, because every dollar counts, every decision really matters. We try to make sure that we're running this thing like a well-oiled machine. So efficiencies are and to your point earlier, not leading with fear, not with the understanding, yeah, I think, some of these payments will be cut. Medicaid is going to be cut. For some folks, we're going to have our charity care is going to increase. We give $25 million a year away in charity care. And that really affects our bottom line. But how do we pivot? It's being adaptable to the environment or our environment because, healthcare is ever changing. And so, for the advice that I'd give is, don't be afraid, be able to pivot. Again, we make decisions based on 2028, not 2026. We're thinking, okay, how does this decision affect, what the landscape could be in 2 or 3 years? And it's worked out. I mean, we're really blessed to have a really good patient population, but more importantly, we have good leadership. My boss always says, people, bad management and lack of leadership closes hospitals. There's nothing else. And I do truly believe that. So, don't lead with fear. But, we try to stay in front of things and be progressive as well. And so, yeah, I really enjoy the ability, our ability to pivot and be adaptive here in this landscape.
So, I know you talked before about learning from your mother and your mother impacting lives, and that certainly she affected you and I guess your approach to your mission, to your leadership. I'm curious if there's anything else, that has had a big impact or affected your approach to leadership and service.
I worked a lot with Special Olympics, and that dates back to, I would say, the early 2010s. And as I began to learn about, different athletes, their backgrounds, their parents, some of the challenges they faced, again, I think internally, my mission-driven kind of drive, so to speak, started to rev up a lot. And I really learned that, there's a certain level of empathy that we all need, but also a certain level of empathy that not everybody has. And so I use that to kind of channel, my performance today. I've learned that I'm way better as an executive when there's personal and professional emotion into it. And sometimes that can get you in trouble. And sometimes it's not, the greatest outcome, especially when you're dealing with life and death. But I do know, and I preach this to my team, and I think it's been effective. There are decisions that we make in finance that can affect patient outcomes. I'll give you an example. When I first got here, some of our vendors weren't being paid. And I got a phone call from one of the surgeons and said, look, I had to push back this emergency surgery because I didn't have what I needed. I didn't have tools. I told my team, I said, if you don't believe that accounts payable, accounting, finance, if you don't think that we have an impact, then you probably shouldn't be here. And we're not going to affect any more lives while I'm here. And we haven't. And so I think that's the type of care and compassion for not just for finance and accounting, but for the community and for the hospital that you have to have working in this environment. And if you don't have it, unfortunately, I'm not a fan. You're not going to work for my team. So that I think that's the difference. I didn't have that before. Like I said, I've been in healthcare on the pharmaceutical side, the med device side, property management side, and you don't. It's just a job. You're there, you clock in, you clock out. But here it's a different animal.
It sounds to me like, I mean, I've heard it described before. It's a vocation. It's not just a job.
Yeah, for sure.
And
For sure.
and you're able to use empathy as a superpower, which is pretty great. So listen, I've heard you talk about this, and I'm curious, looking back, what advice would you give to your younger self?
Focus, focus. I think my younger self was overly ambitious. You're young and you say, okay, I'm going to be a billionaire by the time I'm 40 and everything. But, I think my focus on a singular talent just wasn't there. You try to do it all. But right now, as I've matured and I've gotten older, I've focused on being, more of service, and being the best, CFO slash COO these days that I possibly can. I have that focus. I'm locked in and I see the results of that. I think when you're younger, you're again trying to conquer the world. You're saying, yeah, I can do this, and I can also leave early today and go to this restaurant I wanted to go to. That doesn't work. That's not sustainable. I think when you're focused and you're mindful of what you're doing, you have better results. So like I said, I think just focus and maturity.
That's good advice. So, Ken, one of the things that you've talked about is how important mentorship has been to you. Can you talk a little bit about that and what you're doing to help mentor others?
Oh, absolutely. I mean, mentorship is essential. I think it's kind of losing its luster a little bit. But I've benefited, especially over the last couple of years, working with my CEO, Jose Sanchez. He's been, exponentially positive. He's been a great mentor, especially with his 40 plus years of experience. And, I like to pass that along. And so I do some mentorship at the high school level with girls and boys as far as, what they want to do next in their lives and their careers. And so and even other healthcare professionals, we actually just hosted a Meditech technology kind of consortium here at the Wellness Center. And now we've had over 50 people from across the country reaching out to our IT team. So happy to pay it forward and be of service to anybody that wants to learn more or wants mentorship.
So if somebody wanted to reach out to you, what's the best way for them to get in touch with you?
My email is best, and it's kcoe@hph.care.
Terrific. On the Think Factory, we ask all of our guests, what keeps you up at night?
Yeah. Bad outcomes.
Yeah.
You're in a hospital. It's inevitable. I've had people expire 15 feet to my right as I was, talking to somebody about par levels, things like that. That does keep me up at night. I think that's part of the empathy portion of it, but it's also part of what could we have done better. And so that does keep me up at night. Finance doesn't keep me up at night. That's what I'm good at. But the things that I can't control here, that definitely keeps me up at night. But, now that I'm in operations, I do have, some say and I can impact outcomes better. But naturally, things happen in hospitals and, we work really hard to make sure every outcome is a positive one. But the occasion that they're not, that does keep me up at night for sure.
I hear you. Well, Ken, this has been an incredible look at what it takes to lead with purpose under pressure, where every financial decision and operational decision that you're making connects directly to human lives. And your work shows that innovation doesn't come from abundance. It comes from clarity, constraints, commitments to community and to serving lives. I want to thank you for joining us here on the Think Factory. It's been a pleasure speaking with you.
Yeah, Susan, it's been great. I love what you're doing. So thank you for including me and reaching out. And yeah, I'm happy to have the discussion today for sure.
Thank you so much.